Good evening. Today I will speak to you regarding the biliary obstruction, that is the obstructive jaundice, and treatment perspectives. Biliary obstruction is the blockage of the bile duct by which the synthesized bile from the liver flows to the intestine for digestion of our food. The jaundice which is due to the blockage of the ducts. And as we know, the bile is synthesized or made in the liver, it is stored in the gallbladder, and it goes to the intestine for digestion of our foods. These are actually the female patients in increasing age, and sometimes this disease is transmitted in the family members, pregnancy, diabetes, hyperlipidemia. The commonest cause for this obstructive jaundice is gallbladder stones. These stones formed by the concentrated bile in the gallbladder, which transform to the concretions and finally to the calculus. And these calculus sometimes come to the bile duct and causing the obstruction or blockage of the bile duct. The other causes of this type of jaundice: cancer of the bile ducts, cancer of the liver, cancer of the gallbladder, or the cancer of the pancreas, or sometimes the metastatic cancers. Another important cause of this type of jaundice is the trauma or injury of the abdomen, or sometimes it may be the post-surgical cases. How to diagnose this type of jaundice or the biliary blockage? We can diagnose it by the ultrasound or CT scan, MRI, or sometimes it may require the ERCP to diagnose how the patient is present to us. The patient may have the right upper abdomen pain, and this type of pain generally aggravates after taking the food. There may be jaundice, yellowish discoloration of the eyeball or the skin. Sometimes the itching or the pruritus of the skin. Dark colored urine may be there, pale colored stool may be there. Nausea, vomiting is one of the common symptoms, and fever can also be a symptom for this type of patient. The obstructive jaundice is generally resistant to the medical treatments, and we need to intervene this type of jaundice. It may be by mode of the intervention, radiology, where with the guide of the X-ray or the ultrasound machines, we puncture the bile ducts and we put the tube or the stent to drain the biles accumulated in the liver. And another important thing for this type of patients, particularly when the patient is having the cancerous tumor, if the jaundice level is more than acceptable level, we have to drain the bile first to take the further treatment or the direct treatment for that type of cancer. Any interventions like surgery or the chemotherapy, whichever is required, it is only possible if we can treat the jaundice first. And if we can treat the jaundice, the patient will get better and the patient can be treated directly for the cancerous tumor. Thank you.